Hello, my name is Lexi, and for this presentation, I am going to be talking about research on mental health within older populations. After discussing the current methods that research has shown to help diagnose mental health, as well as preventing mental health, I will talk about potential measures that should be taken in the United States to help the elderly population. Let's first talk about three big components that research has shown that affects the lives of older people and their potential to develop mental illness later in their lives. First is their social network. Their social network involves their ability to have social connections, which includes friends and family. Their social networks help to keep them social and help fulfill their personal social needs. This could be altered or affected by them being a widower, having lost their parents because they are older, having no children or having lost their children, or having no more living friends. Next is their personal economy. In research, it has been shown that individuals who live or have lived in poverty are more likely to develop mental illness. And as far as our older population, a lot of our elderly population did live through the Great Depression or the effects of the Great Depression, which have affected their perception of wealth and in turn affected the mental health of our current older generation. And finally, the social protection of the elderly. These are the opportunities available to them to keep them safe and to keep them sheltered despite no longer working or no longer being able to work. This affects their feelings of safety, which we all know is one of the first layer of Maslow's hierarchy of needs. And knowing these components, knowing this research, the CDC still estimates that 7 million Americans over the age of 65 experience depression each year, with around 16% of suicides involving adults over 65. This does include undiagnosed cases, unfortunately, because most of the cases of depression in the older generations are unnoticed, which in turn means they go untreated. As stated in research by the Public Mental Health Institution in France, currently, mental health in older adults is facing these specific aspects of inaccurate or missing diagnosis due to age-related stereotypes and polymedication. Compared to younger adults, people aged 65 and older are 3 times less likely to report receiving any form of mental health treatment. But at the same time, a large proportion of older adults receive psychotropic medications without a clear diagnosis. A U.S. study revealed that 37.9% of patients identified as depressed received no depression intervention during their 2-month home care episode. Even more surprising, among older adults receiving depression support intervention, 32% of them had no mention of depression in their diagnosis, symptoms, or prescription of mental health services at admission. Whilst researching mental health in the elderly, I found a book on diagnosing mental health in older individuals and found a very helpful case-related book named Practical Strategies in Geriatric Mental Health Cases and Approaches, written by Dr. Laura D. Dunn and Dr. Aaron L. Cassidy Eagle. Within this book, the authors discuss multiple conditions such as depression, anxiety, post-traumatic stress disorder, and how conditions like these relate to older patients specifically. The diagnosing criteria for older adults doesn't make sense for older adults anymore. The criteria is too specific and too lengthy to be helpful to older adults. If an adult over the age of 65 only reaches a couple of their criteria, they won't get treatment they need simply because they didn't reach everything and are no longer allowed to be diagnosed with the label. However, in other cases, they are overdiagnosed simply because of one trait that they have because of their age. They are ignored in all of their other symptoms. For example, it's normal to forget things. Everyone does. At different ages, everyone forgets things. There could be an underlying condition. Forgetfulness could be a symptom of depression or of several other conditions that have nothing to do with the age of the patient. However, being forgetful, while it doesn't mean that you're suffering from dementia or that you're developing Alzheimer's disease, it often gets diagnosed prematurely because they look at the age of the patient and ignore everything else. Preventing misdiagnosis simply involves listening to the entire picture of this patient and not just looking at anyone's age, gender, or race. And as we know, and as we've spoken about before, the statistics about mental health are stacked against older people. They're not actually fitting to the truth, and it's not fair to keep using these statistics to try to diagnose them. Additionally, within this book, they describe the fact that in France, they have annual wellness visits with their elderly, which involve both physical and mental checkups to help diagnose patients preemptively. Now, I've discussed diagnosing mental health and how it's not the same for younger and older people, so let's talk about current research. Actual preventative methods. Within the Journal of the American Society on Aging, Amanda Leggett and Stephen Zaret put together an article where they collected research done on mental health prevention. As stated within the journal, there are 3 forms of intervention which can stand as prevention. There's pharmacological, psychological, and internet-based, as well as other. Pharmacological intervention involves potentially using preventative antidepressants to prevent future or reoccurring depression. Research does show that individuals who do not show all of the symptoms of depression are very likely to develop depression at some point after they are no longer being evaluated and will therefore go unnoticed. Psychological intervention involves therapy, more specifically cognitive behavioral therapy and problem-solving therapy. Having access to a therapy is a large step toward preventing mental health from going within a person who might not have the same resources to have access to it as other people might. Additionally, in older generations, therapy comes with a lot of stigma, and they're very unlikely to seek therapy by themselves. Making therapy normal for older people, or potentially even having it become mandatory at a certain age, could help older people process major life changes, as well as help them understand that their feelings are normal and that they are not alone. In addition to psychological intervention, internet-based intervention is a way to give some patients access to therapy without them having to leave their home. Through internet self-help groups, research has been done in the past to see if individuals could benefit from these therapies without having to leave their homes, and it has been shown that if an individual goes through the therapy for long enough, they will receive the same results as someone who's going to therapy in an office. This could benefit individuals who do not have access to a license or a car or to public transport to be able to go into the office of a therapist. And even despite the potential hurdle of older people not fully understanding how their laptop or their desktop works, it has still been shown to decrease depression symptoms in patients. Another incredibly helpful preventative method is exercise intervention. Obviously, exercise intervention strives to help with the general health of a patient, which will in result help with the mental health of the patient. And the research has shown that patients who stayed active were happier and healthier overall. Because these patients are striving to stay healthy, health complications that can increase anxiety in patients, like having trouble catching their breath, increased heart rate, are likely to improve. And this in turn increases the confidence of the patients and could eventually lead to decreased anxiety. Now that we've talked about research preventative methods, I would like to talk about potential methods that could be implemented in the United States to improve the mental health crisis. Starting with pharmacological interventions, patients have been shown to improve when given preemptive antidepressants. This should not be enforced or mandatory for the patient. However, the patient should have options as to things they could do to potentially improve future episodes. For psychological intervention, therapy should be made mandatory to people at a certain age to protect them from future episodes of undiagnosed mental illness. In turn, if they couldn't go into the office and therapy was still mandatory, there should be options for in-home therapy, for internet-based therapy, for potentially group therapy to help socialize the individual even more, because one of the reasons that therapy does help people is while it does help prevent future episodes and helps catch it early, the person is also getting socialized and is having a moment where they do get to talk to somebody about how they are feeling. Therapy should be accessible for all patients, and once you get to a certain age, it shouldn't be about money, it shouldn't be about accessibility, it should be about how often you go. And potentially this could be done by making it a requirement for something like Social Security or keeping your license, potentially in order to do these things that are very important to your independence as an older individual. It might be a regulated thing where, like, well, we worry about older individuals having licenses because if they are depressed, they could hurt themselves or other people. Additionally, we spoke about it earlier a little bit, but the annual wellness visits that are covered by insurance in France for the elderly involve physical and mental health checkups. And I believe that installing that, maybe replacing that with the therapy, I'm not sure, but doing something where once a year you get an annual checkup, and it has to be this, okay, well, we check your physical and your mental health, and nobody gets pushed through the cracks.